We are fortunate in that the way these courses work, there's a lot of circling around or spiraling. So today it's going to be all old information. Hopefully it will help cement some of the information into your brains, and it'll be a review. Are you going to be tested on this information? Yes. Okay, this is a different course. So you will be retested on this, as well as this will be a good review because a lot of this information is going to end up on your national boards as well. So when you take your board review courses, boom, you're going to see this again, but it'll be ingrained in your head. So we're going to start with the process of care. And what is that starting point? It's the assessment, and you start with the patient history. Okay, that's the medical dental history. And what is the kind of information we're going to collect? You've got the medical history, which we have recently changed on Dentrix to the questionnaire, the personal profile, social history, chief complaint, a history of HX is history or present illness, and then the dental history. So you're trying to get all that information from the medical dental history. And with the template that you fill out in Dentrix, it helps guide you with what to put where so everybody is consistent with what they're including. So the patient history really is an interview. It's not an interrogation, right? You can give the patient history, get the patient history and email it to them ahead of time. But with the way the Dentrix is, you need to go through and enter everything question by question. So it is an interview, which allows you to have follow-up questions. You've got your medical dental history. It establishes a level of communication and a relationship between you and the patient. And it's important to also ask open-ended questions. So things that just are not yes or no. Can you tell me a little bit about this? Do you have arthritis? Yes. Oh, okay. What would be the next question that you would ask? Would be, where is the arthritis? Do you ever need to take any medication? If the arthritis is in their hands or their neck, especially their neck or their back, do you need to make any changes in how the patient is going to be laid back? Can you put them in a supine position? Do they need extra pillow support anywhere? So you're asking that before you've even looked at the patient. Personal profile, name, address, telephone number, age, gender. Again, that's the demographics. Insurance companies oftentimes require that information, as well as for schools and dental clinics, they need that information for grant money as well, the demographics. Social history, that can be kind of tricky. Some patients don't want to disclose certain things. Alcohol use, consumption, frequency, how much, smoking, frequency, how much, and how long have you been doing it, and lifestyle. Okay, so sometimes the lifestyle is, I only smoke when I drink. Oh, when do you drink? Okay, well, I only drink when. And that gets you kind of a feel for what the patient's doing, because you know the more alcohol they drink can have systemic as well as oral effects. Same way with smoking, same way with certain lifestyle, even secondhand smoke. You're always asking the patient, is anything bothering you today? What brings you here today? Now, we're a dental hygiene clinic, so students are going to be asking that, and the patient's going to be looking at you like, I want my teeth cleaned, especially the new patients. But we always ask for a CC, chief complaint, or sometimes you'll see it as C-O for complaints of. Why is the patient here? Do you have anything bothering you? Anything bothering you with your mouth? Okay, well, I've got some sensitivity on the upper right area. It hurts when I chew or when I press down on it, and I was due for a cleaning. So that's the chief complaint. Have any of you had patients with chief complaints so far since you've started seeing patients? Besides wanting a cleaning and I'm your father and you made me come here, or I'm your husband, or
I
you're
have.
my kid.
I have, yes.
Yeah, what was your chief complaint?
It was actually my stepmom, and her complaint was that her gums are like puffy and that she has sensitivity on her lower left molars.
There you go. That is a great chief complaint. And you want to put the chief complaint in quote marks, so the patient, if my gums are sensitive or my gums bleed or my gums, I feel like I have something under my gums, you want to put that in quotes as their chief complaint. And you always address the chief complaint first. So I'm going to go back to this slide. So your stepmother came in and she's got these chief complaints. What happened if her chief complaint would be that she wants her teeth whitened and you notice that she has swollen puffy gums? Would you address the whitening first?
No.
Right. Exactly. You want to get the patient healthy as possible first, but you want to let the patient know that you will address, say, their chief complaint, which is the whitening, but there's other things that need to be taken care of first. We can't whiten until we get your gum tissues healthy, because the solutions that are used for the whitening can irritate your gum tissues. And if the tissues are swollen and puffy, we need to reduce that swelling and inflammation so that your whole tooth structure can be exposed to the whitening process, which really isn't the case, but that's how we present it. We will get to that, but first we have to do something else. And if the patient's in pain, you always take care of the pain first. Okay, and that is the board question. You always take care of the discomfort first. History of present illness. Okay, a lot of these medical histories have a review of systems. So it will take you through the diabetes, the endocrine system. It'll take you through the respiratory system, the digestive systems. They're clumped like that. You want to look at the medications, interactions with other drugs and foods, especially when it comes to herbals. You are responsible for looking up herbals and over-the-counter medications. What are these medications interacting with as far as other things that they're taking? Does it relate to any periodontal problems? Does it relate to increased bleeding? Does it relate to gingival overgrowth? Is there an interaction from this herbal that they're taking with the bleeding or the overgrowth? So some of these herbals and over the counters may seem very innocuous and not important, but it is. And ladies and gentlemen, you need to have a drug card for these. It doesn't do you justice to just pull something up on Lexicomp and have it in a Word document. All right, you have to have a drug card for these. The whole thing is, if there's an incident that happens in the chair and we need that information immediately, trying to search your desktop is not going to do it. But if you've got the drug cards out, boom, we have them. Any questions on drug cards? You can use the pre-made drug cards, but do look for dental implications for them. And so some of them you might need to be writing on the cards after you look them up in Lexicomp. We're still doing history of present illness, drug allergies, especially to penicillin, antibiotics, anything else. Questioning the patient may uncover other diseases. Right? So those are the open-ended questions. Is the patient susceptible to infective endocarditis? Have they had a history of it? If they have a history of it, you can bet they're going to need to be pre-medication. Do they need a medical consult? Now, medical consults can be faxed We have a fax machine that, and the medical office can fax the medical consult back. Now, Michaela had an interesting scenario. Do you mind sharing that, Michaela, yesterday?
Sure. So I had a patient, she has diabetes, so we needed a medical consultation for that. I actually faxed it like over 2 weeks ago, and we hadn't received it back in clinic yet. So my patient was coming in the morning yesterday. And so for the 2 days prior, I had been dealing with the office to get the medical consultation. They ended up finally faxing it. And then when they faxed it, they checked the first two boxes, which it said that it was okay to proceed without any special precautions or the prophylactic antibiotics. And then they also checked the second box where it said the prophylactic antibiotics are needed. So I was like, okay, this is kind of confusing. Does she need the antibiotic or does she not? And then talking with Miss D, her A1C was good. So it was over 7%, which was 7.4. So she typically wouldn't need one. And then I had already previously asked her if she takes antibiotics and she doesn't. So then I had to call them again, like literally while in clinic yesterday because she was coming in. And then to be completely honest, I was talking to the doctor. He ended up getting on the phone and he had like no idea. So I'm like, what's going on? It was just stressful, but that is a stressful process when you're dealing with other offices and they kind of, I guess, it seems like they just don't really, I guess, understand the procedures that the patient is coming in for. So whether they need the antibiotic or not.
So, long story short, too, the patient came in. We got a new medical consult that was signed properly that we can proceed with treatment without any antibiotic. And between conversations and faxing, I think we got like six medical consults faxed all at once.
Yeah, I think it was like 10 because I had like two prior to that too.
So it's important when a medical consult goes out that you follow up. That patient really can't come in again until they have that medical consult. You can't proceed with treatment until we have a signed consult. So it's important that you have the consult, um, follow up on it before the patient comes back. And when you send off that medical consultation form, put your last name on it or your first and last name, print it. We can't tell from the signature, which is the only place your name is on it, who that medical consult belongs to, who's which student. And Stephanie can help also with calling or refaxing the day before the appointment if you still don't have it. Learn where all of the medical consults that come in, where they're placed. There's a little file that is next to the copy machine where they come in and they just get stuck there. So yours might have come in and might have been there for a couple of days. Were you going to say something, Michaela?
Yeah, I was gonna say because I had to have two done so far. So they come in on the fax machine and then she just puts them on the little shelf. So it's your responsibility to go kind of dig through it to make sure that it's there. And then it needs to be scanned into the patient's chart too. I'm not sure if she does that immediately or she just puts it on. I think she just puts it in your the little folder cubby thing on the side of the wall next to the copier, and then you just have to make sure that it gets scanned into the patient's chart.
Yeah, eventually it will get scanned in, but until it does, you need to have that medical consultation out at the signing of the medical history until it does get scanned. So Alexis is saying, isn't there things you can do while waiting for the medical consult? Yes, there are. We can't induce any bleeding, though. We can't induce any bleeding. So that means we can't even do oral health education or oral hygiene instruction. If we're demonstrating toothbrushing technique on our patient and we induce bleeding, a bacteremia is going to be going through their system, and we have caused that. Now, can the patient brush their own teeth? Absolutely. We're not the one doing it. but it's very limited on what we can do. You can do gingival margin, euchogingival line, you can do missing teeth, but you can't go interproximally feeling around the margins of restorations. You can also do an FMX and take the radiographs. That's usually on the first visit. So if a patient comes in and we realize they need a medical consult, we try to keep you busy for that appointment. But what happens if you bring them in on a Wednesday and it's an all-day appointment? So that's where pre-screening your patients on the phone is important to see if they might need a medical consult. You want to make sure that they bring in a list of all of their medications, the dosages, and you want to know why they're taking it as well. But if you can have the medication and the dosages before the patient appears in your chair, you've got all the drug cards made already. We've had cases where a student has literally spent the entire appointment looking up medications, and the patient's just sitting there. So the more you can do ahead of time and pre-plan, let the patient know that we will need a medical consult from your physician, even if it's something as simple as diabetes and they're taking metformin. We will need a medical consult. We'll need a copy or them to tell us what your last A1C was, hemoglobin A1C. And can you bring a fax number for the doctor? So if they already have the doctor's name and fax number, you've got that much information already. It just helps speed along the process because it can be done the same day. You can send it off. If the office is aware that you're sending a fax, they can send it right back to you. Sometimes they only check once a day, if that. So that's the medical consult. Family history. Is there a history of blood pressure, strokes, diabetes, periodontal disease? Is there a history of? All right, it doesn't mean that they're going to get it. It just means those ailments, it means that they might be more susceptible to it. What is their dental IQ? What is their dental history? They might not know anything about what's going in their mouth. They might not want to know anything that's going on in their mouth, or they might want to. What is their dental IQ? Are they even interested? When was their last dental visit? When did they last have an exam? Um, are they going regularly to get their teeth examined? Are they getting things that are recommended to be fixed? Are they keeping up with their restorations? Are they keeping up with their maintenance visits? Right? It's not always a lack of knowledge or a lack of willingness. Sometimes it's a lack of having dental insurance to help pay for some of this as well, or a lack of access to care. And we have a lot of patients coming in that don't have the access to care once you get beyond your family. So we do have a list of clinics in the Northern Virginia, DC, Maryland area that we can give to the patient so they can have follow-up care. We're doing nutritional diet profiles, especially in your caries risk assessment. What is their past dental history? Have they had surgery before? If they've had surgery or they've had periodontal disease in the past, they are more susceptible to it in the future. So the interviewing process helps establish rapport with the patient. We're getting an idea of their medical diseases as well as their medications. We're knowing about the medications also and if they can affect conditions in the mouth. You're in pharmacology now, so you know more about the medications, anti-seizure medications, calcium channel blockers, anti-organ transplant rejection medications, can create gingival overgrowth. Certain medications increase the bleeding. Even the low dose aspirin, 81 milligrams of aspirin a day can increase bleeding. Herbals can, vitamin D can increase bleeding. Okay, and you need to know that. And so you update the patient's medical and dental history at every appointment. Do you do that from Wednesday morning to Wednesday afternoon? The answer is yes. You update it at every appointment. Thank you, Karen. And it's not going through the whole entire process again. Have you taken any medication since this morning or during your lunch hour? Sometimes they'll take an Advil or an ibuprofen. Sometimes they'll take a sinus medication, or something if something's bothering them. So you want to know if there's any changes from the morning. It just takes a couple minutes, and then you're going to retake the vital signs, get your medical history signed in. EOIO, you're doing again. Again, it's looking for changes from the morning. You've already done the big look. Are there new cheek bites, burns, or that type of thing going on in the mouth? So that's the medical history. Any questions on medical history? Then let's go right on into, that's chapter 15. I wanted chapter 14, didn't I? Okay, can you all see chapter 14? Clinical exam, the EOIO?
Yes.
Oh, okay. I see Jennifer saying no, but you can now?
Yes.
Okay, can you see introduction?
It's
No.
not it's not full PowerPoint. It's like the slides itself. Like we can see the ones that are gonna come to, but not like the full screen.
Oh, okay. So let me go here and share that. Well, mine shows it's okay. Hold on here. This is time to go refill your coffee.